Welcome to Ulosca channel. Access all nursing practice questions. HESI RN 301 Pharmacology Practice Questions with Answers.
Question 1. What is a priority nursing assessment before administering digoxin? A. Blood glucose. B. Apical pulse. C. Respiratory rate. D. Oxygen saturation. Which one is the correct answer? The correct answer is B. Apical pulse. Explanation. Digoxin affect cardiac contractility and can slow the heart rate. The nurse must assess the apical pulse before administering. If it's below 60 bpm, the dose should typically be withheld to prevent bradycardia and related complications. Question 2. A client on warfarin has an INR of 4.5. What should the nurse anticipate? A. Administer a second dose. B. Notify the provider. C. Give aspirin. D. Increase leafy green vegetables. Which one is the correct answer? The correct answer is B. Notify the provider. Explanation. An INR of 4.5 is above the therapeutic range, increasing the client's risk for bleeding. The nurse should notify the provider, who may hold the dose or order vitamin K to reverse the effect. Continuing warfarin at this level would be unsafe. Question 3. What is a common side effect of opioid analgesics like morphine? A. Diarrhea. B. Cough. C. Constipation. D. Increased appetite. Which one is the correct answer? The correct answer is C. Constipation. Explanation. Opioids slow down gastrointestinal motility, often leading to constipation. Clients on long-term opioids usually require a bowel regimen to prevent complications such as fecal impaction or paralytic ileus. Question 4. A client is taking furosemide. What lab value should the nurse monitor closely? A. Sodium. B. Calcium. C. Potassium. D. Glucose. Which one is the correct answer? The correct answer is C. Potassium. Explanation. Furosemide is a loop diuretic that increases excretion of potassium through the urine. Monitoring potassium is essential, as hypokalemia can cause muscle weakness and dangerous cardiac arrhythmias. Question 5. Which medication is an antidote for benzodiazepine overdose? A. Naloxone. B. Flumazenil. C. Protamine sulfate. D. Atropine. Which one is the correct answer? The correct answer is B. Flumazenil. Explanation. Flumazenil is the specific antidote for benzodiazepines, such as lorazepam or diazepam. It acts by blocking the effects of the drug at GABA receptors, reversing sedation and respiratory depression. Question 6. What instruction should be given to a client taking tetracycline? A. Take with milk. B. Avoid sun exposure. C. Take with antacids. D. Discontinue if urine is dark. Which one is the correct answer? The correct answer is B. Avoid sun exposure. Explanation. Tetracycline causes photosensitivity, making the skin more prone to sunburn. Clients should use sunscreen and protective clothing to reduce this risk. It should also be taken on an empty stomach and not with dairy or antacids, which impair absorption. Question 7. A nurse is administering insulin Lispro. When should the client eat? A. 30 minutes after injection. B. 2 hours before injection. C. Immediately after injection. D. 1 hour after injection. Which one is the correct answer? The correct answer is C, immediately after injection. Explanation. Insulin Lispro is rapid-acting and starts to lower blood glucose within 15 minutes. To prevent hypoglycemia, clients must eat immediately after the injection to match the insulin's peak action with food absorption. Question 8. A client receiving gentamicin reports hearing ringing in the ears. What should the nurse do? A. Continue the medication. B. Administer an antihistamine. C. Report the finding immediately. D. Reassure the client. Which one is the correct answer? The correct answer is C. Report the finding immediately. Explanation. Gentamicin, an aminoglycoside antibiotic, can cause ototoxicity, which may begin as tinnitus. The nurse must report this immediately to prevent permanent hearing loss and adjust the dosage if needed. Question 9. What is a side effect of prednisone that the nurse should monitor? A. Weight loss. B. Low blood pressure. C. Hyperglycemia. D. Bradycardia. Which one is the correct answer? The correct answer is C. Hyperglycemia. Explanation. Prednisone is a corticosteroid that can increase blood glucose levels by promoting gluconeogenesis. Nurses should monitor for signs of hyperglycemia, especially in diabetic clients or those on high doses. Question 10. A client on MAOIs should avoid which food? A. Bananas. B. Aged cheese. C. Milk. D. White bread. Which one is the correct answer? The correct answer is B. Aged cheese. Explanation. Aged cheese contains tyramine, which can interact dangerously with MAOIs and cause a hypertensive crisis. Clients must avoid high tyramine foods while on this class of medications.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.